My name is Rosalinda De La Luna, and I'm from the De La Luna Foundation, and I'm your host for Viewpoint, coming to you from KSKC TV studios in Paolo, Montana, from Salish Kootenai College. I'd like to thank all my viewers for watching today, and I'm so happy to have this wonderful lady here today. Everyone, please welcome Niki Graham. She is the Prevention Programs Director, Women for Wellness Health Fair, Tribal Bear Project here at Salish Kootenai College. This lady holds many hats of all the stuff that she does, and she's a very busy lady. And Niki, I want to thank you so much for coming on the show and sharing HIV/AIDS information and more about your program and also the work that you're doing in Indian country. And I know that you just went to a conference as well. You just travel all over the place. You're a busy lady. Yes. So thank you. Yeah. So let's start first, Niki. And if you would describe to our viewers, what is the SKC Prevention Task Force?
Okay. So the SKC Prevention Task Force is a group, we're a small group of staff. Right now, all ladies, and we have one male for work study. But what we are, our main focus is to give information on HIV/AIDS and provide HIV testing. So we're located on campus at Salish Kootenai College in the John Peter Paul building. And we try to do outreach events. We host the Women for Wellness Health Fair, that's in May. And along with that, like you mentioned, the Tribal Bear Project, we're also responsible for providing training and education for medical providers, whether that be the physicians, dentists, our pharmacists, nurses, whoever it may be across Montana. I'm responsible for the 7 reservations in Montana, and then we are working with 3 reservations in Idaho. So depending upon which project, I am currently managing 6 grants. So depending upon which, what their goals and objectives are, then we try to do the best that we can in the amount of space that we have to reach all those goals and all those deliverables. So.
And I just want to say, Niki, I attended the Women for Wellness Fair, and it was absolutely fabulous.
Great.
Oh my God. I had no idea. You did such a great job.
Thank
and
you.
You and your staff should be commended for all the work that you did there.
Well, thank you.
It is one of the highlights, I think, for our communities going to that. And I know I'm happy, and I know I speak for other ladies and men out there that attended it, that say thank you.
Well, thank
you so much. Yeah, you're welcome.
That event is absolutely amazing, and it would not happen unless I had my staff and the co-coordinator, Eleanor Viscara, because without those guys' effort, then we just cannot possibly pull that off. It sometimes is. We wonder why we're going in which direction or whatnot, and why people want to participate. But the fact is that we know that we save lives. Maybe it's not HIV and AIDS directly related, but we have positive STD testing, positive hepatitis C testing. So we had some gals that were diagnosed with cervical cancer, some that had some heart issues that were seen by physicians the week after the health fair. So there's so many different things that day, although it's definitely exhausting, and there's definitely a feeling that we have reached gals that we probably would not have reached in our offices or otherwise. So I thank you for giving me a thanks, because, but I pass that forward to the gals that definitely helped me.
And who's on your staff, Niki, if you want to mention them?
Sure, please. Absolutely. Elena Bahi is our prevention specialist. She comes to us from the University of Montana. She actually did an internship with us, and then I was so intrigued by her work ethic and all of her abilities that we were able to get her on full-time. The other one that is full-time is Mary Pepian Racine, who is from Browning. She was a past graduate of SKC Nursing Department, and I've had her primary role is with the Tribal Bear Project and working with medical facilities and getting training into them. But all of us kind of work. We're always in 600 different directions all the time for the most part. Then we have Elizabeth Woodruff, who has joined us. She's just with us for a short period of time. She'll be leaving us in this summer. But she's been amazing and go-getter. Nice. She does testing as well. And we have a media specialist now, which is Leslie Morgeau. And she does our posters. She helps with the web page and just kind of keeps us on our toes for how to reach out to other folks. And then we have a couple work studies that are working with us, and that kind of changes up from month to month, or depending upon the quarters and stuff. So
that's amazing.
yeah.
So going back to the SKC Prevention Task Force about HIV and AIDS, tell me more about HIV testing, about what your program is for people that don't know what HIV means and what AIDS stands for. If you would explain that to my viewers, that'd be awesome.
Sure. So HIV is human immunodeficiency virus. And what it does, you have to contract it. It's not something that's just going to show up in your system. So many times when we're doing outreach or we're doing presentations, we still hear, can you get it from mosquitoes? And I was sitting beside somebody that's HIV positive. I'm really scared. And so there's a lot of myths out there. So we try to clear up those as best as we can. HIV is transmitted through sexual intercourse, through IV drug use, could possibly be through a blood transfusion. That tends to go back to those that occurred before 1985. And then also from mother to baby. If mom's not tested for HIV during a pregnancy, there would be a chance of then infecting her child. So we do the HIV information, but the test itself is a rapid test. So it's very fast. If you were to go to any clinic or ask your provider for the test, it's a very good chance that they would draw a tube of blood, send it in, and then it would take anywhere from 10 to 14 days before you get a call back and then come back in to get your results. Where the rapid test that we use is either oral or we do a finger stick. So we have two options to use with it. Once we start the test, it takes 20 minutes to run, and then after that 20 minutes is done, we can look and see what your results are. So it's very
amazing.
Quick, very quick, absolutely, which in some ways can be very scary. But in other ways, it's a great opportunity to think about, where have you been? What have you been doing? And, you know, am I safe? Or is there other things I should be worried about? So when we do our testing here at the college, or if we're doing off-site testing, because sometimes we test at the tribal health centers, sometimes we test at Lake County Health Department, and sometimes we can just be wherever we can land, sort of thing. We will do a risk assessment, and we'll ask you some very personal questions. Where have you been? What have you been doing? What kind of behaviors may have put you at risk for HIV? And then we get a better sense of where you're coming from, and then we can also find out where your level of knowledge is. I don't think people really understand what they can do or that certain behaviors are putting them at risk. I think what is clear around our area is that chlamydia is here. And that, oh yeah, I know somebody who had chlamydia and they got treated and everything's fine. That's true, you can be treated. But the same behaviors could lead to HIV positive results as well.
Absolutely.
So more than anything, I think we've never, it hasn't happened yet, we haven't given a reactive result for HIV.
That's good.
It's not to say that it hasn't happened or we haven't reached somebody who's actually gone to Missoula or gone to Kalispell to get tested, which is fine by us. If they got the information and found themselves to be at risk, then go get tested. But we definitely have positive chlamydias every time we test.
Really?
We definitely have positive hepatitis C's every time we test. So those tests we don't always have and we're not able to offer all the time. But in collaboration with other folks, sometimes we do have them, but there's always positives there. So those behaviors are here. They're in our valley, so we have to be keenly aware of the fact that what if it does happen? So.
And Niki, because of the fact that we live in such a rural area and it's such a small town, and one of the questions I was going to ask you is like, who should get tested? Well, I would imagine you would probably say everybody, but am I right?
Say
yeah,
everybody.
I know you would. But you know, what do you do if a person is scared if they go to the location here at the college at your center or office site, and they want to get tested, and how do you deal with the confidentiality issue or fear?
I think the best way to answer that is that everybody's an individual. And so when they come in the office and they say they want to test and the door is shut, we offer anonymous testing. So we don't even know who, we don't need to know your first name. We don't, we ask for first names because of our incentives so that we can kind of keep track of where those incentives go, but there's no way to really track who that person is. Funding is sometimes limited, so we want to make sure that if you are somebody who's coming in all the time, that we have funding to purchase tests later on down the road. But for the confidentiality, I think that's the reason why we're still here, honestly. if we weren't confidential, if we ran out and said, you wouldn't believe who came in today, did you see Joe? Joe did this and this and this. I think if we did that, people would talk. And they wouldn't come through our doors. So I think the fact that we are confidential and that they don't feel like their information is going to leak out, or tribal health nurses are going to find out, or Lake County Health Department is going to find out, and people are going to be chasing them down because of their risk behaviors, I think that's why our program's successful. If somebody's scared, we don't have to test you right off the get-go. You're welcome to come in and just ask questions. If you have concerns, worries, or you just want some information, come on in. It's not like we're after you, like we're going to test everybody we can. Although I would love to test everybody that would walk through the door.
Yes, I know you would.
But I think that if anything, we want to make you feel comfortable so that you do come back. And we do have a lot of folks that they'll set up an appointment, they'll take that appointment, they'll come back in 3 months, or they'll come back in 6 months. And to me, that's how we measure our success. If they didn't come back, I would wonder why. And I would try to fix that right away. But we do have people that will definitely come back. Or we've had grandmothers come in who will say, I had no idea. And then the next thing you know, she's got 3 of her grandkids walking in the door and said, you're testing this one, and this one. And then off they go into their testing rooms kind of thing, because they finally understand the importance and say, I had no idea this was here. I'm bringing so-and-so. And they do. They haul them in. I mean, I've had one grandmother, I swear, she pulled that child in by its ear. But what we learn, and we don't share the information with grandma.
Sure.
But there was definitely some education that needs to be shared. Our schools can only say so much, and they can't be open. And so if a student asks a question of a teacher, teachers are nervous that that might not be a situation they want to get themselves into. We're an open book. If you ask a question, we're going to find the answer. And if I don't have the answer, you can bet we're going to try to find it as quickly as we can. We don't want you to be scared.
Has it been difficult, Niki, in trying to go into our public schools in the local area to get this message out about HIV/AIDS prevention and
I don't think
education?
I wouldn't say difficult. I think that there's definitely some teachers we've worked with. We've been in the Polson schools and we've brought different presenters there. We've been in Ronan.
That's great.
We've worked in Mission as well. And I wouldn't say that the other schools are not easy to work with. We just haven't been able to approach them. Our funds are limited as to what we can sometimes do. So the approach hasn't been made that way. But definitely with Job Corps, they've been active participants in the program as well. So I wouldn't say it's difficult. I just think that there's certain limitations that they can talk about, and abstinence-based programs, they have restrictions, but our kids are obviously having problems. One of our testing events that we had done, there was 9 students that got tested, and there were students they were high school students and college age students. I believe the eldest was at 25 years of age. Out of those 9, 3 of them are positive for chlamydia.
Wow.
So it's there, and it's just an opportunity for them to learn that they can go get tested and that it's safe. They can avoid telling their parents at the beginning, but if they are under medication or needs to be reported to insurance, that's when it might come back.
That's when it might come
But they
back.
don't even understand those services.
Wow.
And I don't think we get enough information out about those services to where they feel comfortable that they can walk in the doors.
And with that, Niki, we're going to take a short break, and we're going to come back and talk more about your program here at Salish Kootenai College. Thank you so much.
You're welcome.
So the emotion was the out contest. The ethical noon. Tamaka old scale, Takakas hoistum. Tapis Takakas tutik airport to the noon. So could say, we had wow, to correctness quite to me. Yes, me may, he was the question quite then. We get qua lemon stuck at Chilo stem. Look as cold stem took and cold must look as scaly. Lemon share hoy.
And we're back. Thank you so much for joining us again. On the show is Niki Graham. She's with the Prevention Programs Director here at Salish Kootenai College, Women's Wellness Health Fair, Travel Bear Project. Thank you again for being with us. And so we were talking about HIV and AIDS and your role that your project group, all your kind of work that you do in the community, and how HIV/AIDS affects everyone, basically. And so I just want to say thank you again for doing all that great work. Do other tribal colleges have similar programs like yours?
No. I would say no. There are other tribal colleges that have similar funding, but where they are just startup programs, they're not going nearly as fast as we are with reaching out and so forth. They're trying, but I don't know that there is another tribal college program.
So you're very unique.
Yes.
That's awesome.
Yeah.
That is so great. Tell us a little bit about National HIV Testing Day that's coming up.
Sure. So National HIV Testing Day is June 27th, which will be a Monday this year. And the whole hope is to try to get people to come in and get tested. So we will be having a testing event that day. We'll probably be in 2 different locations. We probably will not be on campus because with campus school not in session, there's not very many folks on campus. We'll probably be at Lake County Health Department as well as Tribal Health. And I think that we're working on testing at Mission at the Tribal Health Center there. So we'll have those details once we get the finalizations. But for the day, we're trying to get people just to recognize, am I at risk? And come in and get tested. So it's a national campaign for that entire day, but that's what we're going to do with our program, is to try to offer 2 different sites. There's a possibility there might be chlamydia, free chlamydia testing, as well as hepatitis C. We just haven't got the final okay on those with those other collaborators.
That's great. And so, Niki, just because we live on a reservation and we work at, your project is based at a tribal college, is it only for tribal people that can get tested, or are you open to everyone?
Absolutely, absolutely everybody. Whoever walks in the door, we do not turn anybody away. If it comes to HIV testing, the only people we turn away are 11 and younger, because our test is not okay to test people that are 11 and younger.
Okay,
so
that's good to
we'll
know.
give them information, definitely. We've had our share of younger youth who are sexually active, and we'll sit down and talk with them about what's putting them at risk and some of the behaviors and what they really need to be thinking about. But other than that, no, it's open to absolutely everybody. Originally, our funding was for only SKC students, but that was something that I didn't feel was appropriate for our area. If you have a student, they probably know somebody who's not a student. Then how do you tell somebody, well, if you're not a student, I can't help you? And I just didn't think that that was right. So the funding we've looked for has been diverse. There is some pots that are just for SKC students, and while there's other pots that are similar kind of activities that are for the entire community.
That is wonderful. So do you have information about infectious rates, trends?
You know, for the most part, HIV is in Montana. It's here. Do we see a huge increase of HIV? Not so much. Something that people may have seen recently in the newspaper was with Riverstone Health in Billings. They had 6 new infections in the month of April, which is not very common at all. But for some people, 6 is like, well, that's only 6. Whereas chlamydia, you can have 6 in one day, sort of thing. But with those cases, it was people who were injecting drugs, and through the contacts and so forth, they were able to reach them, although some of them were not part of that same circle. It was just somebody finding out their status and then notifying those people that they were in contact with. HIV in Montana is definitely, if you look at the statistics, it says MSM, so men who have sex with men. However, it doesn't matter who you are. It doesn't matter if you're a heterosexual female, heterosexual male, things happen. And the risk behaviors are unprotected sex. So if that's the case, then you've put yourself at risk. Yes. In Montana, there's, depending upon what charts and stuff you look at, you see the native numbers. Natives represent about 11% of our positives in Montana. The kicker for the native numbers that really gets to me is the fact that most of them are dually diagnosed. Dual diagnosis means that when they come in, they tend to come in really sick. They have opportunistic infections which are associated with AIDS. And so when they get the workup done and the blood is done, they find out that they're HIV positive, then they do a CD4 count and they find out, in fact, that they're diagnosed with AIDS. 70% of our Native Americans are diagnosed that way. When you reach
That's
an
a
AIDS,
large amount.
it's
Wow.
overwhelmingly
My
large.
God.
We're not getting tested soon enough. It's not that it's too late when they find out that they have AIDS. AIDS is not necessarily a death sentence anymore. It's manageable and people survive it. I have a friend that's lived with an AIDS diagnosis for 25 years. So it's not that it's the end of the world at that point, but it's definitely a harder road to travel if, in fact, your CD4 count is very low, you're not feeling well, you're already sick as it is, and to try to come back and heal from that is not very easy. And I would love to see that the next group, if there's any Native Americans that are diagnosed, that they have if they are diagnosed, it's just HIV, and we can keep away from that AIDS diagnosis if at all possible.
And what is CD4 count?
CD4 count is, we have a T cell count inside of us.
The T cell count.
Yeah,
okay.
so when you talk with somebody who's HIV positive, this is words that they're totally used to. My CD4 count was this, and my viral load is this. So these are this is terminology that they would use. But for the most part, inside of our body, we have white blood cells that fight off infection. Well, part of that are the CD4 T cells. If we don't have very many of them, we're not able to fight off infections, and that's why they get sick more often. So we can definitely, I'll encourage your audience to come in for a training or find out when our trainings are by the website and learn more about those, because they are definitely very confusing, and it takes a little bit of time to understand how that all works out. But once you take some time and learn it, it makes a lot more sense.
Niki, what made you decide to go into this line of work? What made you decide to do this kind of work? I'm really curious, and I know some of our viewers may be as well.
Sure. You know, originally when I came back from Nevada, my husband and I were teaching in Nevada, and we came back home to find jobs. And my background is health and PE and teaching K-12. And I was teaching down there for several years. I taught in Bozeman too, so I was looking for a teaching job. There wasn't a teaching job. So when my husband landed a job, it was like, oh no, Niki needs to find a job. So when I came into the nursing department and had asked about this opening and what it really entailed, I was told at that point that, well, later on I was told that I was the only person that came in that was interested that even could say human immunodeficiency virus. So I landed that job. But, you know, I think what keeps me going, honestly, is talking to people about things that really matter to them, things that scare them. Originally, I wanted to be in the medical field. That's why I chose health and PE. I wanted to be on the preventative side of things. And I think in some ways we are definitely preventative, but I think that we're missing the boat sometimes when it comes to the medical side, because even our medical professionals don't always understand the logistics behind HIV. Now, HIV I hear and see on a daily basis at work, but I think making differences in kids' lives, or the grandmother who says, I had no idea, would you help my granddaughter, or would you help my grandson? Those are the things that keep me going and
That's wonderful.
keep me excited about my work.
And we have a couple of minutes left, but I would like for you to share at least what has been, in your opinion, the biggest barrier you have faced doing this kind of work?
Stigma.
Stigma. It's so true, isn't it?
Yeah.
That is so true.
And many times I've been asked, "You must have HIV. Is that why you do this?"
Oh, really?
Yeah.
Yeah, I can imagine. I can see that.
And the fear. I think stigma and fear out there that people don't understand. I think around here, many times when you speak with elders about it, some of them will say, "Well, I've never heard that," or they're really super afraid of it. But others have mentioned the fact that they just come home to die. And that's all they know, is that when they have AIDS or HIV, they're going to die. And it's a chronic illness now. We can deal with it. It's not cheap, but it's something that we can definitely manage. And things are changing with medicine.
What's your personal hope and goal in the future for education on testing of HIV and AIDS in Indian country?
I think my hope and goal is that there's still funding.
Okay, that funding's
Because funding
a big
is
deal.
if we didn't have 6 grants, we wouldn't be doing this. There definitely would be no way for us to continue this kind of work. I don't know that colleges have the extra funds to support a program like this. Many of the tribal colleges don't have even a health center. So where do people go if they're having health issues, and especially if they don't understand how to sign up for tribal health and so forth? So I think my ultimate hope is to connect people if they need help, to connect them and refer them as quickly as we can so that they're taken care of and they feel safe and they feel healthy.
And as we're coming to a close, I know you have some new news about your program, possibly a name change.
Yes.
And
yeah.
so please tell us a little bit more about
Sure.
that.
Well, we've, because of our work and because of how big we've become and all the work that we do, we've been asked to change our name and to become a center. So rather than being the SKC Prevention Task Force, we will be the Center for Prevention and Wellness. That will be effective July 1st. We're not so sure how it's going to roll out or how that's going to... Well, thanks. I think it's a lot more work.
It's great,
but I hope people understand that we're the same people. It's just a new name to file under. It actually may even help us with other grants in the future. So fingers crossed.
Congratulations on the new name, and
Thanks.
you know, best luck on all of your projects. And do you accept donations, or?
You know, we haven't accepted donations and as to this, up to this point. We do at the Women for Wellness Health Fair, but other than that, we just haven't incorporated that piece yet because we've been okay.
Sure.
We might be asking down the road.
Well, good. Well, if you do, you just let me know.
Absolutely.
And so, can you give us your information about how to reach you?
Sure.
Phone number, email, webpage address as we close the show?
Absolutely. I can be reached at the college campus at 275-4920. Some of my staff can be reached at 275-4913. And for information on the website, that's probably the best place to go. You'll find out all the contact information you possibly need and then kind of what we're up to. That's at http://prevention.skc.edu. So it's not, you can't always type just prevention at SKC, it might not pop up. You have to type in that HTTP.
Okay.
And that will help people find out where we're at, and they're definitely, you're more than willing or welcome to give us a call, and we'll try to answer our questions as best as we can.
That's wonderful. So viewers, please contact Niki Graham with the Prevention Programs Director with the SKC Prevention Task Force. And I want to thank you so much for being on the show. We really appreciate it. And I'm sure our viewers appreciate the information. And congratulations on the new name change. I think that's great. And thank you so much. This is Rosalinda de la Luna with Viewpoint. Thank you.